So I see you have a poster that says healthcare is a right and not a privilege. Can you explain what's your thinking behind that?
Yeah, my thinking is that healthcare is a human right and everyone should have access to it. It should be affordable for everyone, and not a privilege, meaning only if you have money can you afford healthcare.
And how do you do that when healthcare is something that has to be provided? So other people have to create healthcare, the healthcare services and equipment.
For example, I don't think that that people should be denied care at the emergency room because they can't pay it. You know, I hear a lot of people go to the emergency room, and as soon as they're stable, when they find out they don't have insurance, they send them home. You know, so things like that, and that preventative healthcare is important as well.
Okay, so where does this where do the services and goods to provide this right come from?
Right. Well, I think that the choice is important. So you know, if people can afford private insurance and want it, that's good. But also to help people with like through Medicaid and Medicare, but expanding those services. Because for example, like me, I will be laid off in a couple of weeks, and I won't have insurance. But through my husband's job, he makes too much money for us to qualify for Medicaid. But if I go to a private insurance company, I can't afford it. You know, so I think there's a lot of gaps that aren't full, and so because of that, healthcare is a privilege for people who can afford it.
Okay, so what is the difference between a right and a privilege?
A right is something that's offered to everyone, no matter what their conditions or status is. Like a right, right? And a privilege is given to people who, you know, can afford it. So yeah, I just come back from 2 years living overseas, where I see that our U.S. healthcare system is all like third world countries, whereas I was living in Guatemala, where people who were rich could afford healthcare, and people who were poor never got healthcare. And I come back to the U.S. and I see that it's a lot the same, because you know, people lose their jobs, they don't have healthcare, they can't afford it, and the government's not there to help them. There's not a lot of services, or even nonprofits can't help them, and they're left without insurance. But if you have money, no problem.
Do you think that doctors or healthcare companies, hospitals should be required to serve people for free or for reduced rates?
I think they should reduce their rates, because if they reduce
do you think that wasn't the question? Do you think they should be required to provide services for low or no cost to people who want them,
to
anybody who wants them?
But I think there aren't enough free clinics out there for people. There's waiting lines. You know, we do have hospitals that people who don't have insurance can go to, but there's not enough of them.
And one last question. Can you explain the difference between a positive and a negative right?
So, yeah, positive right and negative right. Well, I think we have lots of positive and negative rights. Can you give any? Sorry, you kind of put me on the spot. So what was the question? A positive right.
The difference between a positive and a negative right?
Get back with me in a few minutes. Wait, I think on this one.
Okay. Well, I'll explain to you. A positive right is something that you are given a right to something that somebody else has to provide, and a negative is the government or you know, at whatever level is not allowed to infringe on your activities in that area.
Okay. Gotcha.
So is healthcare a positive or a negative right?
I think it's a little bit of both.
How so?
Well, I don't think that the government should stop anyone from getting healthcare, but I think that it's right that everyone, you know, has to like go out and get it. You know what I mean?
Well, does the government stop people from getting healthcare actively?
No, not actively. No.
Okay. Okay. Thank you.
All right. Thanks.